Welcome to Sustainability Now, solutions to shape a world that works. Designed for everyone interested in responsible stewardship of the planet, covering food, energy, housing, water, waste, health, economics, and consciousness. Welcome to your community, Sustainability Now, with your host, Mira Rubin.
Welcome, everybody, to Sustainability Now, technologies and paradigms to shape a world that works. I'm your host, Mira Rubin, and today I am so delighted to introduce you to Dr. Kristin Reihman. Kristin is not only a dear friend, but a double board-certified doctor in both family and integrative medicine. She's an author and mother who has dedicated her career to unraveling the mysteries of complex, chronic, medically mysterious illnesses. Kristin is also expert in brain injury treatment, having served for the past decade as the medical director of the Family Hope Center in Norristown, PA, which specializes in teaching families with neurologically struggling children how to optimize their children's brains. Kristin's passion for this work is deeply personal. After contracting Lyme disease in 2011, she found herself navigating the same frustrating and often isolating terrain as many of her patients. When conventional medicine couldn't provide answers, she turned to holistic and integrative approaches, from naturopathy and herbal medicine to oxidative therapies and whole food nutrition. Not only did these tools lead to her recovery, but they also shaped a new whole person approach to healthcare. Since then, Kristin has been empowering patients to uncover root causes and heal from conditions like fibromyalgia, chronic fatigue, Lyme disease, mold injury, and now long COVID. Kristin, I am just beside myself excited that you're here with us today. Thank you so much for being with us.
Oh my gosh, Mira, thank you for asking me. I'm so honored to be on your podcast.
Well, folks that are listening, we're a sustainability podcast, and you might wonder why we're here with Kristin, who is in the medical world. And the reason is that health is part and a very important part of sustainability. And learning how to care for ourselves is also part of our mission here. So, and there's such a deep interface too with the pollutants that we have in our environment and the quality of the food that we consume. So, another reason that we have Kristin here, especially, is because you, Kristin, are addressing these mysterious illnesses that so many more people are living with or trying to live with on a daily basis. And it's rather epidemic in proportion. And you have found pathways into addressing these conditions that are not commonly known. So I'm so excited for you to share some of that. The other thing is, people say, don't drink your own Kool-Aid, right? Well, you have come to these solutions or these approaches through deep personal experience. I don't know anybody that's a better testimonial for the brain health work that you do and the physical health work that you do than you are. So you're not only an academic expert, but you are tried and true proof of the pudding. So where should we start, Kristin?
Well, as you were introducing me and then sort of doing the extended introduction and talking about the overlap of why is a doctor on the sustainability podcast, I've been thinking about that question too. Sort of like what's the overlap in the Venn diagram that is your work and my work and your life's passion and my life's passion and our lived experiences. And I immediately was like brought back to this moment in my own Lyme healing journey. And I think it was probably the first moment in the actual true healing for me of Lyme. I had been to this homeopath and she had told me what my remedy was, and I had gone home and started taking my remedy. And part of my part of my issue was I felt like, one of the things she said to me, which was deeply stirring and, shocking, and also I think very healing, was, it sounds like your body, you keep describing this as your body feels like it's trying to die. Your lungs almost don't want to take breath. You have to will yourself to breathe. And that's really how I felt in 2011, 2012. And she goes, and so I need to know, as your provider, are you trying to live or are you trying to die? Because it makes every bit of difference in terms of how I support you on this journey,
Oh,
which
I
was
just
like,
got chills. You ask it, like, what doctor has the courage to ask that question?
yeah, or even the awareness to know that that's what you're dealing with, right? That sort of level of ambivalence, like on a sort of existentially spiritual kind of, dark night of the soul level, is really what's at play. And it really was the issue. And I remember going home with that question and just feeling like, I don't even know how to answer that question. And I immediately realized, well, how do you answer any question? You imagine yourself on a path with one choice and you see how you feel. I mean, that's how I've made all my decisions in life. Um, and so I said, okay, well, I'm going to die. I'm going to choose death, choose to not live anymore. And there was no emotion, Mira.
Yeah.
There was like, maybe other than surprise, like, huh, that's interesting. There's no emotion about that. Pretty high stakes decision in that particular outcome. But really, I didn't have any emotion. It just was like, no, it'll be very straightforward. Like, you'll pass on and your family will find another mother and your husband will find another wife, and it will be okay. Like, everybody will be okay. Work will be okay. They've already kind of moved on without you. You've been out for 5 weeks. Like, everyone's going to kind of find their way and it'll be fine. And I was like, oh, that's interesting. I said, well, okay, well, what's the alternative? I could live. And again, there was no immediate feeling. There was no sort of like, yes, I want to live. There was no booming voice. But what there was instantaneously was this clarity. And the clarity was this: if you're gonna live, there's gonna be no living for fear. You're not gonna be living in fear of like the kind of doctor you're becoming through all this and what that's gonna do to your reputation or your connections to your medical tribe. You're not gonna be afraid anymore. And I'd been very afraid. You're only gonna be here for joy, for bouncing on trampolines, and for saving the planet. Like, that was the clarity and that was the ultimatum. And I was like, fascinating. Fascinating. Okay, well, I'm going to go to sleep and see what I feel in the morning. And the next morning, I woke up and had the same conversation. And again, there was no emotion. It was just like, this is one way, this is the other way. And the next thing I knew, I was out of my bed, walking downstairs and getting ready for eating breakfast in downstairs. And my husband was like, what? You're downstairs for breakfast? And I was like, yeah. And he's like, well, that's new. And I was like, wow, that is new. And then I got on the Lanta bus and they bounced me to my physical therapy in hot water for 20 minutes away. And I did my hour and I came back. And then I got out of the bus and walked into the garden. And I remember thinking, wow, I'm in the garden. Like, normally I'm in my bed, go to my thing, strategically get back in my bed. And I was like, no, I'm in the garden. And wow, there's the red bud and it's blooming. And oh my God, it's spring. Like, last time I was outdoors really consciously, it was winter. This is interesting. And that's when I texted the homeopath and was like, I don't know if this is me choosing life, but it kind of feels like my body is. So I just wanted to let you know. And she was like, woohoo, keep me posted. But
Wow.
that moment of like, if you're staying, you're going to stay here for fun, for being with your kids, and for saving the planet. I was like, okay.
Wow. This took a turn, a totally unexpected turn in the conversation. That is spectacular. Wow. And I think, I've been connecting to the notion of life as its own intelligence, that we are one neural network within that intelligence, so to speak. And that what I'm hearing in your conversation is life choosing to continue to express itself through you. So,
Hmm.
how beautiful. I'm so grateful.
Mm. Do you know that poem, that song that that's made from the poem by Khalil Gibran called On Children?
No.
What you just said reminds me of this beautiful line. I was listening to it yesterday coming home from swim practice, and it says, "Your children are not your children. They're the sons and daughters of life's longing for itself."
So yes, 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 yes. So one of the foundational things that I share with my clients and that I live into as a practice is life is happening for me and through me rather than to me. And so that allows me to transcend the limits of my own identity to expand into something greater. So, yeah, and there's a power to that because you get to live for something beyond just whatever this little compartment is that we think we are, right?
Yeah. And
Wow.
thank goodness for that. Like this can get so boring, right?
Right.
I
Right.
wish there was more.
Right. Oh, wow. So there's so much. First of all, thank you for welcoming us into that deep connection and conversation. I just really appreciate that. Um, and there's so much I want to talk to you because there's so many people who are really suffering and struggling from Lyme and COVID and long COVID and ADD and ADHD and autism, and these are the arenas that you play in with such courage and grace, and you've been attacked for it, I think. And like you said early on, is that you have felt alienated in some respects from your medical tribe. Um, and the approaches that you're taking are somewhat controversial because they're not the traditional story. So you've had Lyme, you've had a traumatic brain or a brain injury, and you've come back from these things. And I think that one of the most powerful lenses through which to have you tell your story is through your personal experience and the kind of treatment pattern that had such a profound healing effect for you. I want to double back though. I don't know that everybody knows what homeopathy is. And if you could just give a brief definition of that, that would be awesome.
Sure. So to start, I'm not a homeopath and I'm not an expert in homeopathy. I have used homeopathy because it checks all my boxes. It's simple, it's affordable, it's profoundly effective when it works, and anyone can use it. So it's kind of one of those great tools. And so I've found my way to it as an adjunct. So homeopathy is a whole system of medicine, diagnosis and treatment that was very, very prominent at the turn of the century, the turn of the last century. It was sort of shut down and vilified by what's now considered medicine because there were competing schools of medicine at the time, and the one that won out is the one we know now. But homeopathy has continued on, and essentially it uses a system of like treating like. So you
Which is
take
kind of the concept behind vaccines in its way.
right, right, in its way, it is. So you give a little something that causes the disease in order to instruct the body how to manage the disease on its own. So in a way, it's very similar to the concept of vaccination, and it also uses a system that involves dilution. So the way in which you take that poison or that toxin that causes disease and make it non-harmful is you take a tiny bit of it with some water and you take a drop of that, you dilute it again and again and again. In between, you're doing this thing called succussing it. So you're kind of shaking up the molecules, and that creates some effect that is thought to be, well, the message in the molecule is ending up in the structure of the water. so that at the end of the day, you don't have any of the stuff left. If you've diluted it 6 or 10 or 100 times or 200 times even, you don't have any of the stuff. And actually, when you run it through a high performance liquid chromatographer, which is a fancy word for big machine that tells you what stuff is there, you don't find any of the stuff. You just find water, except the water in the theory of homeopathy has been changed in the process, through the process of dilution. And when you take that water in a prescribed way, usually multiple times a day, and up until you experience some resolution or some shift, then you can have a resolution or shift.
Thank you. I really appreciate that. I had gone through a course of homeopathic treatment also and was absolutely gobsmacked by the impact on my emotional body, even just on how it shifted my being state. And that's what you were addressing kind of in the beginning. So that's why I asked you about it. I really appreciate that. So tell us about where should we start with your story of Lyme, maybe? Or I definitely want to make sure we talk about the brain.
Okay, well then maybe we start with a little bit of the Lyme story, because there was definitely some brain injury that happened with the Lyme. And before I kind of tell you what happened, then I'll just back up and say I really think about brain injury, number one, as a not a finite and fatal and forever event. So I know when people hear the word brain injury, they're like, oh my gosh, they're brain injured. They're not functional. Maybe they've got some deficits still, which is certainly true in many cases if you don't know what to do or how to heal the brain. But if you believe that neuroplasticity, or the ability of the brain to grow and heal and organize and get better, is possible, and that's pretty clearly been demonstrated now in the last 20 years in literature, you can find all sorts of examples of that.
But you're a testament to it yourself.
And if you believe the evidence in front of you, I mean, I work with brain injured kids and their families, and I see miracles, what other people would call miracles, all the time. Because it turns out if the brain can actually heal, which it can, and you know what to do, and then you actually do it, things get better. So I think of brain injury as two sort of separate, discrete, but sometimes overlapping categories. And the first would be what you think of when you think of a motor vehicle accident or a stroke, lack of blood supply to the brain, maybe with a cord around the neck for a baby who's born blue. And the brain takes a hit for long enough or in a large enough way that there is damage done, and there's an inflammatory response that is usually temporary, but ends up in scarring, and then lack of, some deficit somewhere, some lack of function in whatever part of the brain was hurt. I would say that's the first big category. The second big category is present in that first, which is to say when there's that initial injury and inflammation is happening, which is the body's response to any injury. White blood cells come in, mast cells, macrophages, neutrophils, and they clean up the debris, they make a little fire, and then they brush away the dust and the ashes. And then you have a scar that forms. But while the inflammation is present, that's like an additional injury. That's an insult to injury. So you have a brain that's gotten a hit, but now you have a fire that's being made around that hit. And so you could be temporarily worse if you have both things going on. You could also have a brain injury that's present just because of inflammation from a variety of causes, right? You can get inflammation from COVID, for example. COVID was well known and is well known to create this thing called a cytokine storm. Most people have heard that term by now. It became mainstream. Doctors always knew it. It basically means your immune system is dumping a bunch of molecules to make a big fire. And that fire has downstream effects, which sometimes can be harmful and lasting and create even more injury. If you have ongoing inflammation and it doesn't resolve, either because you still have an input coming in, you still have spike proteins sitting on your cells from a COVID vaccine or from COVID itself, you still have a diet that's not agreeing with you and creating inflammation in your body, all manner of things. You still live in mold, you have Lyme disease, there's all sorts of environmental things that can create simmering or sometimes intermittent episodic inflammation. Those brain injuries are often waxing and waning because the inflammation is waxing and waning. It can make it harder for people to understand that this is a brain injury we're dealing with. It's an ongoing simmering brain injury. And if there's overlap between those two things, it can make it very hard for people to understand what's going on. But I think if we think about those two categories, it can be helpful because the things I'll be telling you about might work more on one than the other. So when I had Lyme disease, I would say the brain injury I was struggling with was the second kind, the kind where you have inflammation. I had neurotoxins from the Lyme. I had probably downstream effects from all the inflammation of my immune system trying to manage the Lyme. I have genetically poor detoxification pathways. So many people are familiar now with the MTHFR defects. I have all those. I now know that I have some clotting disorders that make it hard for my body to break down biofilm. I just basically became a sludgy mess that couldn't get rid of the toxins and the inflammation when I had Lyme. And so I really tanked. Not everybody with Lyme disease goes down so hard. I lay in my bed for weeks and weeks and weeks. I lost 30 pounds. I was in excruciating pain. I had a crazy sciatic nerve that wouldn't rest unless I was flat on my back. And all of that was a function of really high levels of inflammation plus inability to kind of get rid of the detritus and all the downstream effects of that inflammation. Not to mention effectively to kill the bacteria in me because of all the biofilm. So it was kind of a perfect storm. And the brain injury for me looked like this. I couldn't find my words. I couldn't remember names of people in front of me. I couldn't remember from one person to the next. If you went around the room in a circle of 10 people and everybody introduced their name, normally that had been my superhuman strength. I knew their name forever. Now I couldn't remember their name once the second person started talking. I couldn't remember that I'd left my keys in my car with my car running. I'd go in the house and 2 hours later I'd have to get in my car again, but I couldn't find my keys to get in my car because I was like, where's my keys? I finally would just give up, go to my car thinking maybe, and lo and behold, there my car's keys were. So it was bad. I couldn't calculate math. I couldn't do the tip in the restaurant. It just was not the brain I was used to, right? And it made it very difficult to see patients. Luckily, I took some time off. I was able to kind of get my bearings a little bit, but it took a while for that to come back. And I had to build in a lot of extra support so that I could do my job and be functional in the world. So that brain injury was temporary, and I wasn't doing anything to recover other than recovering from Lyme and getting the inflammation down and letting the fire kind of put itself out. So thankfully, I didn't end up with any deficits after treating the root cause of that brain injury. Fast forward, a couple years after that, when I'd gone back to work, I found my way through a whole other interesting story of synchronicities that I won't bore you with, but they were fascinating. And I landed in the position of medical director at the Family Hope Center. So this was a place that I'd never learned about during my residency, using concepts and paradigms that I'd never learned about in medical school or residency. But when I finally learned about them, I was like, this is what everybody with a brain needs to understand. Because it's not just about hurt kids who have hurt brains and manifest in all sorts of things from autism to Down syndrome to ADHD to dyslexia to cerebral palsy. Like all of these labels really come down to the brain hurt in different places in different ways and to different degrees. Injuries that, again, are treatable if you know how to do it. And that's not a paradigm that's being taught in medical school. The paradigm
thought that they're not treatable, or the only way to treat them is through pharmaceuticals rather than
or PT, I mean, physical therapy. So, but here's what I learned in medical school, and this was still the paradigm in residency, and I believe it's still the paradigm, though I can't 100% know because I'm not teaching in residencies anymore. But the paradigm was, oh yeah, the brain can heal, it can make some progress for 60 days, which coincidentally is how long insurance pays for rehab.
totally coincidental.
So, I mean, and what if they, instead of for 60 days, what if instead of using for 60 days their standard therapies, which get you some part of the way, what if they were actually employing a bottom-up approach like we use in the Family Hope Center that invokes deep neuroplasticity, deep and lasting neuroplasticity from the ground up? Like they would have such better outcomes. But this isn't mainstream information yet. So I have somehow found my way, as you know, into all these little nooks and crannies that are way off the beaten path, but I found my way there because I really am a fan of things that work, that are accessible, that are sustainable, and that frankly will get the job done and get people back to living their awesome lives. And that's not, unfortunately, business as usual in medicine.
So tell us, what is this protocol? What is this new paradigm? The paradigm is that the brain can really, truly heal. I
That's
guess.
the first step, right? That's the first assumption. And if you don't buy that, then I would say you don't believe in libraries. Like go to PubMed and look at all the studies on neuroplasticity. You can see, and I remember the first one when it came out, there was a couple that came out. There was one in Cell and one in Nature, I believe, which are of course the biggest sort of publications in in science. When I was in medical school and I was about to go on my neurology rotation, these big publications announced, oh my gosh, rat neurons seem to be able to well heal and grow and reorganize. And everybody was like,
Well,
because
I remember years and years ago that the idea was that we only have so many brain cells, and after a certain point, they just start dying off and we degenerate. And it's not something that is is regenerative in any way. That used to be the idea, I mean, long
right,
time ago.
right. And when you pushed, and that was sort of the sort of layperson's paradigm, but when you push the neurologist and say, but what do you make of these studies? They'd say, pipe down, medical student, because no one's actually really going to make use of that for another 20, 25 years. And also, it's going to be really hard because nerves are so demanding in energy. They take so much time and reprogramming to heal. I'm like, okay, so you're saying it's hard, so we don't talk about it? That just has never really done it for me. So the paradigm is essentially this. If you take, let me back up and tell you what a newborn baby knows, okay? Because they actually are experts in growing a brain. They go from a brain that really can't do all that much to like an adult over time. And the way they do that, let's even talk about the first 4 months. The way babies go from being a baby to a 4 month old is not from sitting in a dark closet, not getting stimulated, right? It's from getting really good nutrition, hopefully, and really good stimulation of the lowest levels of the brainstem, which builds a foundation so that the brain kicks in on its own to grow and heal and organize. Because it turns out if you stimulate the medulla and the pons, which sits on top, medulla is kind of like the little ice cream cone, and pons kind of sits on top. So the whole midbrain structure is this lowest level of the brain right before it goes into the spinal cord, and then the whole cerebellum and cerebrum sits on top. If you stimulate that ice cream cone at the bottom, the message becomes grow, heal, organize. It's kind of like when you do exercise, your muscles start priming for more exercise and they set themselves up to grow and heal and organize and be better at what they do. The brain is no different. So, how do you organize the ice cream cone? I've never called it the ice cream cone. Family Hope Center founders are going to be like, what the heck is she talking about?
I was
But
just
I
falling
like
in
it.
love with the fact that you're calling it an ice cream cone, because immediately I've got a real visual. So it's
Me
brilliant.
too. Me too. We're gonna run with it. So if you do the things that a brand newborn baby should be able to do just by reflexes alone, those reflexes are there because it helps the brain get the message of, hey, this baby's using it, it's engaging with its environment. We got to grow and heal and organize. So what are those reflexes? Well, it turns out a baby has like upwards of 20 or more reflexes that are primal and innate and in there, wired into its ice cream cone stem so that it can actually crawl up mom's belly and latch on a breast. So not many people know that, but if you watch videos, and midwives have some of these, the greatest videos, which I know about because when I had my fourth, I really wanted a home birth. And so we had to watch, we got to watch a bunch of midwife videos. My husband would be like, are you going to make us watch the midwife porn again? Yes, we're watching the midwife porn because you guys have to know how to deal with this baby coming out of me in the living room. So one of the coolest videos we saw was this baby who delivers right onto mom's belly. Nobody touches the baby because if you touch the baby gets locked into its upper part of its brain. It doesn't stay in its brainstem. And then it's like, what's happening? What's happening? It's the reflexes shut down. But if you leave the baby alone on its belly and the baby is neurologically intact, amazing things will start to happen, including that baby will move its arm up. That's a reflex. That baby will move its other knee up. That's a reflex. That baby will dig its little Babinski toe, which is wired to be like bent backwards at birth when it hits the ground so that it can push off that foot. And it starts commando crawling like a little robot right up mom's belly until it finds, oh, something against its cheek. What is that? A nipple? That's a reflex. Huh. and it moves in there. And so all these reflexes help baby not only get born, we haven't even talked about the reflexes that baby uses in the womb to push its way out, but then crawl its way up to mom safely, get on a breast, and feed itself. How cool is that? Well, it's not only cool because the baby now gets a meal. It's cool because every reflex that baby used to get there send a message to the brainstem, to the ice cream cone going, grow, heal, organize, grow, heal, organize. And that creates the impetus for neuroplasticity, and that builds an organized brain from the ground up. Babies who do not get floor time on their belly, and I'm not talking like 5 minutes a day, I'm talking like you make them stay on their belly as long as you can in between meals, because that's what's inviting their brain, calling on their brain to grow and heal and organize. Babies who lie flat on their back get nothing. Their reflexes are paralyzed.
Wow.
There's no reflex that happens when a baby's on its back, unless you touch its cheek and give it an impetus to kind of turn and suckle. There's nothing about movement or functional development that's going to happen when a baby's lying on its back, which is, by the way, how we tell all parents to put their babies to sleep now.
That's what I thought.
Wow. So think about that. So it turns out that if a person with a brain, and I don't care what age you are, gets on their belly and learns to properly commando crawl on their belly, keeping their body on the ground, bringing their foot and their knee up, pushing off their toe, using an opposite pattern there, cross pattern, they send a message to their brainstem that says, grow, heal, organize, and neuroplasticity kicks in.
Now, this sounds, I'm sure, to people listening, this is outrageous.
I know, right?
Outrageous. So the thing is that you did this. You creeped and crawled.
Yeah.
And I also want to understand more about the proper way to be doing this creepy crawly thing and the equipment that you actually employ to do it without injury. Yeah.
Yeah, I'm happy to talk about all of it. It's both, first of all, it's not rocket science. Remember, babies know how to do this. When you're an adult, there's some more obstacles, right? Like there's the mindset piece that says, what the hell am I doing on the floor? And by the way, how come my floor's so dusty? Right? Like there's a lot of pieces that sort of get in your way. A baby just gets on the floor, and once they get this down, they're like, oh my gosh, I can move. And it's really cool. Like, as you said, I did creep and crawl, and I'll tell you that story if you're interested, back in 2022 for 8 months.
Yes.
And I remember having moments on the floor of just like exhilaration. I was like, oh, right. This is what it felt like when we realized we could move ourselves across space. So cool and so crazy. But yeah, anyone can do it, and it's super simple. And the hardest part is the mindset piece, and also making sure your floor is not so disgusting that you actually want to be on your floor. And the other piece is, of course, bony knees and aching bones and being out of shape, all of which I was dealing with when I had my other brain injury, which I can probably tell you about now.
Yeah, that would be great.
Okay. So 2022, I was cranking along. Like COVID had been easy for me, health-wise, just because I know what to do with inflammation, and I'd done elimination diets forever. And so I was like eating a really clean diet, and I was exercising, and my whole family was home. We were raising chickens. It was awesome. Until I developed this crazy little nerve back pain thing, which ended up being a pinched nerve, a herniated disc, and some fibrotic spaces back here that were keeping my C7 nerve root from being happy. And it was creating eventually all sorts of terrible pain down my arm. I did physical therapy for 6 months, and on and off it was better, but then it was just much worse. And when I started to develop fasciculations, like little flickering movements and, stuff that makes you think you have Lou Gehrig's disease, I was like, I'm done with this. Let's get an MRI. And so they did an MRI that showed a really pretty severe nerve impingement and spinal cord impingement as well. Luckily, I wasn't having spinal cord symptoms yet, but it made everyone nervous. And so we decided to do surgery. And I woke up from that surgery different. Number one, my arm pain was gone, which was, a blessing. And that was the whole reason I'd had the surgery. But my brain felt really different. And I spent several weeks and even a few months thinking, well, this is just the anesthesia. I did a bunch of detox stuff, thinking this is the inflammation, and this is just the slowing of brain. This is my poor detoxification pathways, and I'll just, supplement all those things and try to support that. But by the time I went back to work several months later, I realized I really wasn't okay. I had
There were voice things too. Your voice was very, very different.
right,
Isn't
right,
that
right.
interesting that that just happened?
Yeah, that is interesting. So yeah, I mean, the voice thing was actually, I don't believe part of the brain thing, but it was kind of a distractor from the brain thing because it meant I couldn't work. So I woke up from that surgery and I talked like this. I had no voice. And that lasted for 2 months. Actually until I got COVID again. And my first symptom of COVID was a headache. My second symptom was my voice came back, which was fascinating. And thanks, COVID, whatever. But because that was kind of the main thing everybody was focusing on, I didn't really pay attention to the other things because I wasn't challenging my brain. There were potholes there, but the traffic wasn't enough that I noticed them. I could kind of maneuver around them without noticing them. But when I started to get prepared to go back to work, I began to notice some things. Number one, I felt very off balance. I wasn't dizzy, but I would get very nervous walking downstairs. I needed the handrail, which I was like, well, that's interesting. Maybe I'm just out of shape, right? I haven't done yoga in a year because of this back pain and this neck thing, but maybe that's it. I also had this sensation um, of not seeing well. It wasn't that my glasses didn't work. I still felt my glasses were the same prescription, but I just felt like my vision was a little bit off. And I figured, well, I should go to the optometrist and just check that out. But it didn't sort of rise to the level of concern. What really bothered me was when I went back to work, the first week back, I was seeing some families in Amish country. I work with a lot of neurologically hurt kids there. And the families are lovely. And I have many of them that I've known for a long time, including a child who has a feeding tube. And I saw this family who I'd seen at least 6 or 7 times, over the 4 or 5 years I've been in Amish country. And I examined the feeding tube. I was speaking to the mom. The child was losing weight and not thriving in the way we want this child to thrive. And after the whole exam and the whole history of knowing them, I suggested to the mom it was maybe time that we consider a feeding tube.
Wow.
Which was, mortifying.
Wow. How did
Yeah.
you get the awareness of yourself making that recognition, that suggestion? How did you
Well, she
get?
said, well, Kristin, he already has a feeding tube.
Oh my gosh.
And I was like, right, the one I just examined.
Wow.
So later that week, at the end of the week after I'd seen everyone, I was talking to Matthew Newell, who's the, co-founder, co-director of Family Hope Center. And that's, we're working there together. And he said, how are you doing? How's your week? And I was like, well, it was great seeing people. Like I really miss seeing patients and I miss my people. And that was fun. But honestly, I'm really kind of tired and I don't feel like my brain's working all that well. And he goes, yeah, I was going to ask about that. You have a new right lateral strabismus, which is fancy doctor speak for your right eye is like looking outward. And I was like, oh, and a new strabismus is concerning. I mean, sometimes at the end of the day, people will get like a little bit of a convergent strabismus. Their eyes start to kind of cross because their brain, well, it's because your brain is tired and you don't have the energy to keep your eyes straight. Your muscles are weaker and not able to function. But mine was kind of had been there. And I realized at that point, that's why my vision was blurry. And I also realized at that point that something had happened to my brain because, it had been going on for the whole 6 months since my surgery. And I said, oh my gosh, did I have a stroke? And Matt, who's amazing and does body talk and can kind of scan you, you always feel like you're being in like a Xerox scanner. He was like, yeah, you had 3, but you're going to be okay. And you know how to fix this. And you can borrow the hyperbaric chamber at the office and we'll get you on a program and we'll do it for 6 months and total transformation. Like he just went right to problem solving. And I like I felt like I'd been punched in the gut. And suddenly all the little ditties I'd noticed, all the kind of balance issues, the kind of overwhelm with multitasking. Oh, the other piece I didn't mention is if I had to think hard about anything, I would just start yawning. Like, I mean, in the middle of patient care, I was like, this is not professional or okay at all. But it was like the demand to hold things in my brain and keep things organized was so great that like everything else, I think of yawning as kind of like a pre-seizure almost. It's like your brain going, you need some more oxygen here. So yeah, it was not a happy moment. And to be honest, I didn't get right on the floor and start creeping and crawling. I pretty much was like in denial, super grumpy about it, like just and basically planning my exit strategy from work. I'm like, okay, I'm just not working anymore. Like, I don't need to work. I don't need to see patients. I don't need to do anything that requires my brain. Maybe I just like garden, learn a little bit more about herbs, look forward to grandbabies one day and like call it a day. Like it was kind of like I went straight to like, okay, we're limping to the finish line. Which, if you know me, it's not really.
Not at all. It's like, who is this woman?
Yeah. Which I later realized was part of the brain injury.
Yeah.
Like, my pons took a hit. That's the top of the ice cream cone. And pons is where the motivation lives. I mean, if kids who aren't motivated can't clean their room, sometimes it's because they're disorganized and they literally just can't remember one thing to the next. But sometimes it's because they're like, I don't care about a clean room. Like not caring about your hygiene, not caring about your brain function. Those are brain injury issues. And they're treatable and they're fixable and they're healable. So thankfully, even though I wasn't really ready to get on the floor, I mean, and part of it too is I know what that's like. Like I had two of my kids creep and crawl just to kind of get their brains really tight when they were, sub 10 years old. And I know it works and I know it's hard. I know it's hard. And I was like,
So just as segue briefly into your kids, it was for issues around ADD, ADHD.
yeah,
So
yeah.
can you just like briefly say what the transformation was in your kids?
Yeah, I mean, it took a couple years for one of them. It took about a year for the other one, although both of them had noticeable difference within a couple months of creep. In fact, my daughter, the way we finally decided to creep and crawl with her was that I was in Florida with her and she was bouncing off the walls as per usual in the grocery store. And the checkout clerk said to me, "Oh, my granddaughter also has ADHD," which, by the way, this is apropos of nothing, right? She just volunteers this. And by the way, my daughter did not have a diagnosis because at that point we weren't looking for labels. We were just looking for fixes. And she's like, "Oh yeah, the fish oil's over in aisle 6." And I was like, "Well, thank you. Is it that obvious?" Yes, it's that obvious. So the other thing that happened on that trip was I was in the ocean with her. We took a little beach trip. And I have these pictures of her, and it was at dusk, so she was a little bit tired. I could tell it was like the end of a long day, but she was running around, splashing in the wave. Took all these pictures, and when I looked at them later, she definitely had crossed eyes, and I was like, "That's a brain injury. Why have I not seen that before?" So I asked her, she was a really smart kid, really good reader. She like already was like through the second round of her Harry Potter series, like maybe 2 or 3 rounds in. And so I was like, "How do you read? Do your eyes work okay?" She's like, "Oh yeah, I have no problem as long as I close one eye." I was like, "Okay." So we got her some glasses, which she promptly lost. And 2 weeks into creeping and crawling, she didn't need them anyway because her
Oh,
eyes straightened out.
that's amazing. I used to read with one eye closed too. So I think I need to start creeping and crawling.
I mean, here's my message. If you have a brain and you care about it, why not? Like, it again checks the boxes. It goes into the category of can't hurt, might change your brain for the better, and might create like a total transformation, and how easy it is to manifest all your genius. Because when you have a brain that's disorganized at the ground, like at the ground level, there's a lot of workarounds we have to build into our world, right? There's a lot of like extra supports that we create, reminders, sticky notes, like notebook, like all these things that we have to build into our life, plus the energy it takes to manage all those things. And that energy can be spent somewhere else when your brain's not disorganized.
Yeah, we learn all these compensatory sorts of behaviors.
Yeah.
And I love that it frees up energy to actually express our greatness or our potential. So tell us about the rudiments of the creeping crawling and the equipment for the knobby knees and
Mhm.
elbows and such.
Yeah, so I'll give you a quick overview. I strongly recommend anyone who's truly considering this to go to the Family Hope Center's website because they have their whole course online now. And
Awesome.
it's the first 3 modules are completely free. So you can get to know us, get to know our approach a little bit before you decide to buy the whole thing. If you buy the whole thing, you get a couple of phone calls with the team to help you basically like fill out your own chart. The chart is where you figure out where your own brain has little ditties, little glitches, and then create a program that will really identify and support those glitches while you're creeping and crawling. So it's a really robust online course and comes with some support. So that's what I recommend people really do if they're interested in doing this. But the
Wait. What's the website?
familyhopecenter.com.
Okay.
Yeah.
Good enough.
Yeah. So essentially, it requires a long, smooth, flat surface. And I used my hallway, which was about 10 meters long, which was a nice unit because it allowed me to count, without having to use too much of my noggin, which was the struggling part and the reason I was on the floor. I used knee pads. In fact, I used 2 sets of volleyball knee pads on each, 2 sets total. So 2 pads on each knee, one right under my kneecap, which is where you kind of put the pressure when you're creeping. Creeping is hands and knees. It's what most humans call crawling. We like to switch it around because we go by the old original texts and descriptions in the neurology textbooks. But creeping on your hands and knees, or what most people call crawling, really gets at that place beneath the kneecap. So you put it on the way volleyball players wear it, which is below the kneecap. The second one I put on over the kneecap, and I slightly angle it so that the pad is a little bit inward on the insides of my knees, because as I'm bringing up a leg, it's bent, and the part of it that hits the floor is that inside upper knee. So those are the knee pads, and you can get them on Amazon. They're pretty cheap. They last not forever if you're actually doing the work. So even though you have to buy another pair 3 or 4 months in, you can say to yourself, well, I'm actually doing it. And because your brain's already feeling better. And then the other thing I used was elbow pads. So they sell these too. You can get a smaller knee pad for that, or you can get actual elbow pads. I like the smaller knee pads. I find them easier to get on. And then if you really want to make it as easy as possible, which I recommend, because I think if it's going to be sustainable, you have to be able to sustain it, right? And easy makes it easier to sustain it. I like the Vibram toe shoes, which are those kind of running shoes that have little finger toes in them, and they have kind of a rubbery bottom. And that allows you to get some both bend into the Babinski reflex, which is where your foot pushes off in the belly crawl, and also to get some purchase on your slick floor.
And so you said that there's a special commando way to be doing this, and I'm wondering if you can explain what that is too.
Would it be better if I pulled up a little video and showed it?
Well, sure. Let me give you permission, and we have people that are hearing this on their podcast platforms. So I would love you to describe it also. You should be able to share your video now.
Okay, I'm not sure how well I'll describe it without the video. So let's put the video in, and I'll walk you / crawl you through it.
Awesome. And I
Okay.
think one of the reasons that we're going through this detail is because I think there are many, many of us that are challenged by ADD, ADHD, memory as we're getting older. This is something that is functional and effective across all ages.
Yep. Anyone with a brain can benefit from this. And not everyone should start full gung ho, right? If you have an injury in your hand or wrist, or you have trouble getting on all fours, or even lying on your belly, try lying in your bed and just moving into the position where you move your arm and your head in this way with one bent right arm, turn your head to the right, bent left arm, turn your head to the left. This will start to both create the strength in the upper back and trunk, but also get the brain kind of interested. Oh, what's that? You're flirting with the reflexes here. All right, so here's a video of me crawling on my belly I'll take out the groans and the grunts. So this is me crawling on my belly in my hallway. I'll play it again. navigating the dog.
So let me just say, for those of you who are listening to the podcast on a podcast platform, you can actually see our interview as well as this video if you go to our website at sustainabilitynow.global. And we'll be putting the links and references also on that site. So you can check that out. Amazing. Okay. So it
So
is
there's
commando style where your body, you're shifting kind of at your waist using opposite leg and knee and opposite elbow.
Mhm. And
Yeah.
if you think about the toe dig is the part that most people miss. A lot of people will get on their belly and they'll just try to pull themselves along with this sort of ladder hand over hand motion. That misses the opportunity that is the reflex invocation by using the feet and the legs and the knees. It's really part of it to use the feet. The other thing to say is the cross pattern piece means that when you're pushing with the left foot, you're rolling over the right arm. So you can see how as you push here I push with my left, my right arm is the one I'm kind of pulling beneath me as I roll over it. So that's crawling. Here's another crawling video from behind. I'm
Again,
pushing with the foot.
this one shows the toe dig more effectively.
And you notice my foot comes all the way up to my knee, and then I push. 80% of your forward momentum should come from the thrust of the feet.
Okay. That's
Now,
wonderful.
if you watch, Army recruits don't all know how to do this. A lot of people show up to their basic training disorganized, neurologically disorganized. They slept on their backs. They never got a chance for belly time. Maybe they had an actual brain injury in utero. Maybe they had a vaccine that gave them a little bit of a hit. There's a lot of reasons people's brains get knocked. And the way out is understanding that the brain grows by use and it grows from the ground up. And getting into these reflexes is the way to do it. The other thing that is important is crawling or creeping rather. Let's see if I can go back there. Where's my creeping? Creeping is hands and knees, what most people would call crawling. And there's me moving forward. Creeping makes more sense to people. And a lot of people don't have a cross pattern. They're moving their right hand and arm forward at the same time as their left. That's not how you do it. You have to be opposites.
I notice you're not wearing any kind of protection or support in your hands or your palms or your knees.
Yeah, that was just for the purpose of that short video. I was frequently sending my videos to the team to make sure I was doing both adequate, movements, but also adequate distance.
And as far as distance, what are you looking at?
So that's really personalized based on a person's need. I will tell you that in the beginning of my journey, when Matthew gave me a mini program before he flew off to Denmark for 6 weeks to see families there, he said 300 meters a day of crawling on your belly, 600 meters a day of creeping on your hands and knees. So a total of almost a kilometer of, moving on the floor. And that felt like a lot. And he said, work up to that over several weeks. I got up to that in like 2 weeks, felt really proud of myself, did another month of that, was noticing major differences, meaning my motivation was back. I was really understanding like how to move forward in my day. Like it's hard to explain, but I would get up in the morning, in the early stages of this, I would get up in the morning, I would go through the rote things, I would make breakfast for the kids, I would put everyone on the bus, and then I would sit down and be like, what am I supposed to do today?
Right.
Like not just in the house or in my work, but like big picture, like who am I supposed to be? It was very disorienting.
Yes.
And well, then I would say, well, what do I have to do? I know I have to creep and crawl. May as well check that off the list. And within 80 meters of crawling on my belly, I would feel my brain turn on. I would feel like it was like, I felt like everything kind of integrated. And I was like, oh, right. Okay. I remember my schedule. I remember who I'm supposed to be. I remember what the plans are. I remember how to do it. Like I have the motive. I'd have that drive. It felt to me like people who drink coffee describe needing coffee in the morning for their brain to wake up.
Wow.
Like I've never been a coffee drinker, so I can't tell you if that's true or not, but that's what I was saying. I was like, oh, my brain's waking up. I'm awake now to my life.
Wow. Well, I can relate to what you're talking about. I mean, you're just reaffirming. It's interesting because in observing myself most recently, with an awareness toward ADD, ADHD, etc., I notice that I have a lot of those symptoms.
Mm-hmm.
And so that was kind of a revelation to me to see that, oh my gosh, this is actually something that I'm experiencing. And I think that a lot of us are coming to that awareness where we hadn't been previously. So I think that this is such an important universal message. When you and I were talking about why medicine on sustainability, what's the connection? And you were talking about how we need brains. We need our brains to be able to be online, to be able to address the demands of the world in this moment and moving forward. So I so appreciate that.
Yeah.
We have a little bit of time left. I want to quickly just look at what shifted. We hear what shifted for you. I mean, you're back.
Yeah.
What happened with your daughter? You said you did the creepy crawly thing with her, and what happened with her?
Yeah, both the kids who crept and crawled are doing awesome. They're both, thriving academically. They're thriving socially. I think if you asked them and they didn't think they were going to have to get back on the floor based on their answer. If you asked them if it was worth it, they would both say yes. And I say that because when my youngest, got the message from me, got the memo that he was going to be on the floor for a while because there was some behavioral and disruptive behaviors at school that were causing him to get into, smart boy trouble, too much smart boy activity. He was not happy. And my daughter was like, listen, you're going to hate this. You're going to hate mom. Every day you're going to be so angry, but do it anyway, because it really matters and it really is going to help you. And I was like, whoa, I'm not going to say anything, but I'm just going to tuck that away. So yeah, I think that they would say that it was helpful. It's interesting. When I told my son I was going to get on the floor and do this, I said, hey, any chance you want to get back on the floor with me, just because it'll just take you even like next level? He's like, no, mom, I'm really glad you're doing this. But if you want, I'll sit with you on the floor and read Harry Potter to you while you do it, which is kind of how it went down for him. And I was like, fair. Okay. Fair play. Yeah.
Well, you said when you were telling me about your son, you were telling me that the teacher at school said, what are you doing with this kid? What happened? In a matter of weeks, wasn't it?
Yeah. Yeah. A month to 2 months is when we had a parent teacher conference, and she was like, what are you doing? What have you changed? Because he is my model student. He's directing all of his energy and attention when he's done with his work early to like helping other kids, asking me how he can help, organizing this over here. Like he's just become so much easier for like before he would be distracting other kids. It was just it wasn't functional in her classroom. And she's like, something major has changed. And I was like, scoreboard, baby. That's crawling.
Remarkable. It's remarkable.
Yeah,
Magical.
we have kids on the program whose parents come and tell us he's in mainstream school, and when he struggles with when he starts to feel overwhelmed during a math test, he'll ask the teacher if he can go crawl a little bit in the hallway, and then he'll come back and he'll finish his test.
Oh, that's remarkable too.
Yeah.
Wow. And so all these kids that we're medicating, we could be having them creep and crawl and see some results. Probably for the greater part of them, the greater number.
ADHD is like low-hanging fruit.
Wow.
It's one of the easiest things we treat at the Family Hope Center. And
Wow.
parents are, and a lot of people, I want to be clear. Like, I celebrate whoever you are and whoever you want to be. And I think people should be allowed to make choices about what they do and don't do for their brain to help their brain. But I think if we can change the conversation away from there's something wrong with you, you're a bad person, you're a bad kid, you're different and bad, like that's not what anyone wants, right? But change it to, look, you're a brilliant person who has to work 3 times as hard as the next guy because you've got some hard drive issues here that we can fix. Doing the things that you would have done if you'd been given the chance when you were a baby, probably. And
So I'm going to interrupt you because I'm very cognizant of the time, and unfortunately, we just have a little bit of time left, and I want to make sure that you talk about Lyme and long COVID? And I know
Oh,
that's not a short
that's
conversation,
not a short. Well,
but
here's what I
I
would.
know that you have developed resources for people, and I'm hoping that maybe you can give a little bit of a teaser. Maybe we'll have you back to have a conversation about that in greater depth. But in the meantime, maybe you can direct people to some references and give a little bit of a teaser about the fact that these things too can be corrected.
Absolutely. So, like for anyone hearing this who's struggling with the sort of brain inflammation kind of story or body inflammation and feeling hopeless, I'm here to tell you that is not the end of your story, right? This is a chapter, and you have to find some help and a team and some resources to get you out of the hole, but you can absolutely come out of the hole. So, the way I am serving the planet is by trying to get brains and bodies back online so that we can all do the collective work that we need to do to heal our world. And I have, to that end, I have put together many online programs. Some of them are free, some of them are very low cost. I'm trying to get information in the hands of as many people who want it so that they can do the work with some guidance and support and community to get their healing on. So yes, Lyme and long COVID are absolutely treatable. And there are lots of resources to do that. One of the ways you can do that right away is my ebook. So my ebook is called Life After Lyme, and it was written before COVID, but all the things in the book are still relevant, and they're foundational for reducing inflammation and getting your terrain back in order so that your body can be the healing machine that it wants to be. I also have coaching programs both for Lyme, and I have something called the Healing Grove. We happen to be doing this year in the Healing Grove a full year of brain healing collectively. So I think we talked about me giving a big discount to your people if they want to come into the brain healing course. So I have a 7-day course, and it's all self-paced. You can take it on, it's online. It helps people heal their brain and understand the tools for healing their brain, not just physiologically and physically, but on all limbs of their tree. So emotionally, spiritually, socially, conceptually too. And that's available and with the coupon from you guys for you guys to get at a really reduced rate. And people who want more can come into my programs. This is where I'm giving some hand holding and some guidance, and we use the community to kind of empower people and create accountability so that people can do the work at home and do it within a connected space.
So I want to just put a date stamp on this. This is the end of 2024, and your brain health program is going through 2025.
The brain health program will always be available. The Healing Grove focus starts this year, this fall, and moves all the way to next fall. And we may run it again because it's been such a powerfully compelling invitation. A lot of people now are just, getting on their hands and knees and asking for support and finding what they need to kind of do it at home and get their brain back online.
So how do people contact you? Where can people find your book and your other resources?
My website is the best way to contact me. They can also, that's KristinReihmanMD.com. They can also find me.
Spell that because your name is spelled in an unusual way.
KristinReihmanMD as in medical doctor.com. I'm currently off all the socials. I got removed from all the socials, I think, because as Mira said earlier, there's some controversial things I say, like your autism can heal. And the powers that be have currently decided I can't be there. So I'm really working through my email list, which you can sign up for on my website. That's where I share information. I also have a podcast that comes out every week. You can find that on Spotify and all the other podcast places. It's called the Healing Grove Podcast.
Wonderful, wonderful. So we have a few minutes so that I can ask you, what would you like to share that you haven't yet shared or I haven't yet asked about? Just in a couple minutes.
I guess getting back to this notion of you can heal, I think a lot of people are banging their head against the wall because they're going to their regular doctor and their doctor is saying there's either nothing we can do or there's nothing real happening here.
Or it's just a function of getting older.
Or it's just a function of getting older. Like, yeah, I have like 30-year-olds in my practice who come in saying, I think I'm just getting older. No, 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 do not get on that train. because that train is called the limping to the finish line train, right? Do not give up. If you are looking for ways to feel better and there's a part of you that says, yeah, it's not normal that I'm waking up exhausted after a full night's sleep and I'm only 48 or only 62 or I'm 75 and I felt great last year, but now I'm going down the tubes. No, something changed. Figure out what changed. Find a doctor or a practitioner who understands that this is not normal and who's willing to partner with you as you look for solutions.
I love that. Thank you. It goes back to the question, are we choosing to live or are we choosing to die? And there's a lot of richness available if we opt to live. So I'm so grateful for you, Kristin, and for your courage, tremendous courage and generosity in sharing your heart and your vision and your commitment. So thank you so much.
Thank you, Mira.
Thank you to everybody who is listening and watching. Please share this out to folks. Please let people know that there's a lot more hope than we can believe, than we have believed, perhaps. And I want to say thank you to all of everybody who's carrying the torch. And thank you to my partner in crime here at Sustainability Now, Scott Billy, who's also our producer. And I think that's a wrap for today. Live your best life, love the world around you, and together we can save the world. Thank you so much.
Thank you for listening to Sustainability Now. Visit sustainabilitynow.global to find resources related to today's program. While you're there, pledge your support by making a contribution to help us shape a world that works. And remember to subscribe, share, and follow us on social media.